This procedure is life-changing. If you've been in significant pain for more than 8 months, you should really look into this procedure.
If you're watching this presentation, you or someone you love is likely suffering from lower back pain caused by herniated or bulging discs. You've tried all the conservative treatments, from physical therapy and chiropractic to injections, traction, and some serious pain medications, but nothing's worked. If you've been told you're out of options, that the only next step is invasive open spine surgery, we hope you'll listen to the stories of patients just like you. Conservative treatments failed them too, but their doctors used HydroDiscectomy and the power of water to wash away their back pain, with no cutting, no hospital stay, and no lengthy recovery period.
I tried everything to avoid having any kind of invasive surgery or any procedure done to me. I had extensive physical therapy. I had many epidural injections. I tried everything, and it just wasn't working.
I tried therapy, and believe me, all kind of an injection they gave me, it didn't work. I used to take a lot of pain medicine because I can't sleep. I never sleep. I always in pain, 24 hours. I was crying.
And the doctors kept giving me injections, facet injections, epidurals. I went through numerous for years, for like 10 years.
Then, Jennifer, Rima, and Tim's physicians chose HydroDiscectomy from HydroCision. HydroDiscectomy is a proven, minimally invasive procedure that uses a high-speed water stream to remove herniated disc tissue, relieving the nerve pressure that causes back and leg pain.
The procedure itself takes approximately 3 minutes. That means that the needle will be inserted and in for about 3 minutes until an adequate amount of disc material is removed. Following that, the needle is removed and the patient's allowed to go home shortly thereafter. With the HydroDiscectomy technique, the patient leaves the facility with a Band-Aid.
Leaving the procedure with just a Band-Aid on your back is only one of the differences between the minimally invasive HydroDiscectomy and open back surgery. With HydroDiscectomy, there's no cutting, so there are no stitches and no unsightly scar. You're under local, not general anesthesia. After the procedure, you go home in a few hours and go back to work in a few days, not the 6 to 8 week recovery period with open spine surgery.
The procedure didn't involve cutting of tissue. It was less invasive. They basically were not operating on me, cutting me.
Procedure was set up to be at 7 o'clock in the morning, so we had to get up early. It was probably the hardest part of the whole thing was getting up early.
Once the anesthesia wore off, I felt great and got up, looked in the mirror, saw this little teeny Band-Aid, took it off, and I was like scared to death to take it off, thinking I'd see this huge like bloody scar, and it was like a little pinprick.
HydroCision spine jet technology has been used in more than 40,000 surgical cases worldwide. In one clinical study of 69 patients, 98% reported excellent or good results after 150 days. Let's hear how the HydroDiscectomy procedure changed the lives of our patients.
And since I've had the procedure, the world is my oyster. I've been to Italy, Bermuda, Jamaica. I'm a travel buff, and I can do everything I wanted to do and I used to do.
Being able to, within an hour or two of leaving the hospital, actually sit and have lunch with my wife, pain-free, just seemed like a miracle.
I finally went back to work after I had this procedure done by Dr. Tommy, and it's great. I got my life back again, and I can walk now. It's great.
I can walk, I can do my regular job, and I can do my normal work at home. It did change my life.
The HydroDiscectomy procedure is not for everyone with lower back pain. But if you've been diagnosed with a herniated disc in the lumbar region of your spine, ask your doctor if HydroCision spine jet technology is right for you. For more information, visit our website at WashFwayBackPain.com.